members tonight. So welcome to everybody to the regular monthly meeting of the Indian River County Hospital District in December. Can't believe it's the end of the year already. Thank goodness, right?
Goodness.
It's the end of the year. So first, what I'd like to do is if everybody could join me in a moment of prayer. Thank you, Lord. We want to recognize you at the end of this year here, at the month of your birth. And it's been a tough year for so many people. So many people have lost loved ones, lost friends, lost family, and lost their jobs, and just been a very difficult year for everybody. Please give us strength, give us hope, give us light at the end of the tunnel, and let it most of all give us love to cherish with each other and hold each other and help each other and give each other strength. So as we go into this new year, let there be goodness, let there be friendship, let there be love, and let there be life and hope. Amen. Thank you. If we can do the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, if I can get a motion for approval of the chairman's meeting minutes dated November 18th, the regular monthly meeting minutes dated November 19th, and a December disbursement of Mr. Jones.
$1,112,647.09.
Can I hear a
So
motion?
move.
Second.
Okay, and all in favor? Approval?
Aye.
Okay. I don't really have a lot to report. I do want to just remind anybody who has not gotten their flu vaccine to please get their flu vaccine. It is especially important this year, but it's important every year to do that. So please do that, and I'll give words at the end when we adjourn. So given that, Jennifer Peschke.
Okay, thank you. This month, we accomplished a lot of things being completed that we've been working on for several months, so that's a good thing. We've completed the right-of-way transaction with the county, and we are currently working with counsel for the VNA and the Cleveland Clinics Council to amend the existing easement agreement the district and the hospital entered into following the closing in the end of 2018, so that that document is accurate and reflects the changes that we made with respect to those properties. We've also completed the amended and restated lease matter with the VNA, and the fully executed original is on file at the district's office. And at this time of the year, we're always looking at trustee bonds, and we have been working with the insurance company that issues the bonds for each of you as trustees, as required by Florida statutes, to make sure that they are properly renewed and in place before the new terms begin in January of '21. Any questions for me?
Hearing none, we'll go into the financial statement. I assume we are in good financial shape.
We're the best. You know, on the golf course, there's an old saying, fast pay makes fast friends. And it seems to apply to Indian River County taxpayers. Through November 30th, as is reflected in your executive director's report, the district had received a little over $5 million of the budgeted $14.7 million. That resulted in the district's total deposits as of November 30th, including the carryover from the previous year, totaling about $8.4 million. So far in December, another $4 million of taxpayer prompt payments has been received, and thus we've received already about 70% of our expected tax revenues for the year, and we anticipate we'll be over 80% by the end of December. Anne Marie Siriano sends, just to be certain we're not talking about Anne Marie McChrystal, sends our funds to our investment manager, Water Walker, as appropriate, while maintaining enough in our bank account to pay bills. Currently, Water Walker, through its custodian bank, TD Bank, holds over $12 million invested in FDIC guaranteed CDs, yielding a projected, wait for this, 0.32. That's less than half the amount we received over the total last 12 months, but it's better than nothing. And as Mary Beth started out, we're in great financial shape. We got the rest of the month to spend this, the rest of the year to spend this. In fact, we got the next 8 or 9 months. And I don't think we'll be able to do it. So we're in great shape. Thank you.
That's great. I did want to say, I forgot to say that this meeting is being televised on Channel 27 along with a live stream on Zoom. If you are on Zoom and watching this and you have a question or you want to make a comment, write your question in the comment section and then we'll deal with that during public comment. So I apologize, I forgot to mention that in there. And it's good to hear we're in good financial shape.
Yeah.
We can help the community a lot with that. Anne Marie Soriano.
Okay, in a different spot, so make sure my microphone's on. I did enclose with your materials my executive director report for the month, so I don't have any new items to add to that. I'm just going to add to Alan's report that when I did talk to him the other day, I reflected those balances. We now, through December, have received $7 million, so we have received 12.5 of our total budgets, and I moved another $2 million to Water Walker, so that 12 million.
Okay, good. We're over 85% now then.
Yes, we are.
Good.
So, unless there are questions on my report, I don't have anything other than that to add.
Okay. We're very happy to have the in Cleveland Clinic, Indian River Hospital, all of the management folks, it appears to be, here this afternoon for their semi-annual update. So I will turn it over to you. Welcome.
Thank you very much, Madam Chairwoman. I do want to take the opportunity to thank the hospital district and the community publicly for their support over the past year. It has been a challenging year for all of us, and we're grateful for the support of the community, just as we hope we provide support to the community. And so thank each of you, and thank you to the community that's listening. I do want to introduce my executive team that's here. They do the bulk of the work at the hospital. I think we have Warren Fuller, who's Chief Financial Officer, Dr. David Peter, the Chief Medical Officer, Dr. Chuck Mackett, who is the Associate Chief of Staff for this region for Cleveland Clinic and the President of IRMA, Dr. Ralph Turner, who's our Chief Operating Officer, Pam Burchell, who's our Head of Human Resources, Linda Walton, our Chief Nursing Officer, and Dr. Rick Rothman, who is the Chairman of Hospital Medicine and helps lead a lot of our COVID efforts, both here locally and regionally.
Welcome to all of you. Thank you for being here.
So thanks for this opportunity. I'm going to cover several different areas, including the scope of services offered or contemplated, the annual quality goals and a review of the benchmarks and our achievement rates, the extent, types, and value of indigent care provided to the citizens of Indian River County, capital spending this year, and it's not required, but I am going to add in, obviously, a COVID response and what is to date, and to give the group an update on things and where we are, because I think that's really, really important, not only for the district, but for the community as a whole. So the scope of services, the focus areas remain the same as the last year for us. There's 4+1 areas. It's heart and vascular, neurosciences, oncology, orthopedics, and primary care. There's a Cleveland Clinic Florida-wide focus, not only Indian River County, working in cooperation to bring increased access and scope of previously unavailable services across Florida and the Treasure Coast. Obviously, 2020 has been a challenging year. We understand the impact that our new Epic rollout has had on individual patients in the community, and that was highlighted with the Epic rollout. The amount of resources required is significant for that rollout, and on behalf of the clinic and Indian River Hospital, I do want to apologize to the community for the inconveniences that we know that has caused. So I wanted to state that publicly. We continue to provide and strengthen women's health services. We've established a maternal fetal medicine program that's available through telehealth here, and it went live effective 12/21 of this year. It's a previously unavailable service to the women here, and that's through our Partners program, and it's in connection with Cleveland Clinic main campus and providing that. There's both on-site periodically as well as telehealth services that are providing that service to residents of Indian River County. Behavioral health services are more important than ever, especially during this pandemic, and we've seen an increase in utilization of those services. The admissions in behavioral health are up 6% in 2020, and just as a reminder, compared to 2019, well, actually, that's compared to 2019, but there was a 22% increase from 2018 to 2019, so there continues to be a significant demand for those services. We've continued to invest in staff, training, and security measures, including additional lighting at BHC. Other additional BHC highlights include a pilot program to admit youth directly to avoid the emergency department. Got off to a little bit slower start this year because of the COVID pandemic, but it is in progress. The pool was filled in and the ropes course was taken down specifically for security reasons at the BHC, and that was part of our overall security assessment when we started, and that's been completed. We've improved the staff security system with locators for staff wherever they may be in the building, and enough buttons for all staff so that they can actually feel secure when they come to work. We have approved funding for a new Baker Act entrance for BHC that has been provided, and that work will start this year, actually 2021 being next year. And the refresh was including new and bigger TVs for the units, new outdoor seating, new therapeutic materials for the clinical departments at behavioral health, and an addition of telepsychiatry monitors for the main hospital. Now we have 3 in the emergency department and 1 on each floor, and so that's an increase from 3 to 7. And that allows us to provide telehealth inside our own facilities and soon to come to health and wellness. We've opened the new stroke unit successfully and continue to provide stroke care for our community and region as a primary stroke center. Our stroke metrics remain excellent and in fact have improved over the last year. We've successfully recruited 2 neurosurgeons to Cleveland Clinic Indian River Hospital and are seeking a 3rd. In addition, we're actively recruiting for many other specialties. When we recruit, we're recruiting for talent to our community, and there are many talented physicians that are already here. But when we look at new physicians to add, we look at service lines that maybe don't exist here previously. I referenced maternal fetal medicine as being one. In the cardiovascular area, we've recruited 5 new physicians, including 1 new cardiothoracic surgeon, 2 interventional cardiologists, an additional electrophysiologist, so now we have 2, and an additional general cardiologist. We're noted to be high performing by U.S. News and World Report in heart failure. This year in November, we completed our 200th TAVR, which is a transaortic valve replacement, and those patients routinely go home within 48 to 72 hours of the surgery. Just a reminder, we were at 100 in the first 6 months of 2019, so that's a significant ramp up of that process. We've also performed in this last year our first MitraClip procedure, which is a very similar procedure. It's a mitral valve repair that occurs through the groin, and it's non-invasive, and likewise, those patients go home and have a rapid recovery, go home within 48 to 72 hours. And so we've performed our first several of those successfully. We are nearing the conclusion of our search for the new director of the Scully Welch Cancer Center, and we'll likely have an announcement sometime early next year. So we anticipate that early in the first quarter. In the interim, Dr. David Peter is serving as the interim director until the successor is named. We've added several orthopedic physicians to our medical staff over the past year and are noted to be high performing in hip replacement also by U.S. News and World Report. As many of you know, we've announced that Primary Care of the Treasure Coast will be joining Cleveland Clinic effective January 1st, 2021. Primary Care of the Treasure Coast has provided care in Indian River County for more than 20 years. Today, it is one of the largest physician practices in Indian River County, with 12 physicians and advanced practice providers. The practice has offices in Vero Beach and Sebastian to serve Indian River County as a whole. Primary Care of the Treasure Coast and Cleveland Clinic have a shared culture of putting patients at the center of everything that we do. Working together, we will strengthen and improve access to high-quality care for the communities that we serve, and we continue to recruit primary care physicians. So since January of 2019, we've successfully recruited 41 physicians. That does not include Primary Care of the Treasure Coast. Those included, that would be a total of 53 physicians to the medical staff over the first 2 years. I want to turn our attention to item number 2 that we will cover. The annual goals, benchmarks, and achievements for quality. We'll be transparent on the numbers with you on what has worked well and what opportunities that we still have. Hand hygiene, which is core to everything that we do, whether now we're in the hospital or out with masking, wash your hands, etc. We've added many new trained observers, and we do over 800 observations a month to get the numbers. I am happy to report that this year we're at 93% compliance versus 84% on the prior year. Our goal is 100%, so we're not satisfied. It is on the right trend line, but we're confident that we will get there. Clostridium difficile reduction, and that's notable for the efforts that went into this. Hand washing has a role to play in that. Additional 2-step testing was added. But to give the numbers, we had 35 cases in 2019, and through November, we've had 15 this year. So that's a significant reduction in that, as well as the rate. We're performing well in central line bloodstream infections, MRSA, pressure ulcers, falls, and 30-day readmission rates. I'll go through some of these numbers. On readmission rates, we're at 9% with a target of 9.4. We're one of the leading hospitals in the clinic system for readmission rates nationally. Blood pressure control, we're at 80% with a target of 90%. In 2019, we were at 72%. So we're not at the goal, and we're not satisfied with that, but 80% is a pretty good number for that. We strive to achieve 90% or better. In Cleveland and in other areas, those numbers are much less than 80%, so kudos to the team for that. Diabetic control, hemoglobin A1C less than 9, we're at 94%, which is an amazing number. We were really good in 2019 as well at 92%, so a slight improvement, but caring for our diabetic patients and patients with chronic illness is important, and those are 2 key metrics that we measure along those lines. Sepsis mortality or bloodstream infections, 2020 we're at 11% with a target of 11%, so we are right at our target. Urinary tract infections caused by urinary catheters. We continue to focus on removal and the judicious use of urinary catheters in the hospital. 2020, year-to-date through November, we were at 6 with a target of 6, so we're right at target, but we'd like to see a lower number there. MRSA, or methicillin-resistant Staph aureus, which is a bacterial infection. In 2020, we have 2. In 2019, we had 3. Our target is 1. So not at target, but close. Clostridium difficile, we already touched on. We had 15 this year with a target of 21, and last year we were at 35. So significant improvements. I'm going to change gears and we'll talk a little bit about volumes, 2018 through 2019. The impact of COVID and the pandemic on non-COVID related hospital visits has been fairly significant, not only locally, but across the country. And so I will tell you the numbers on the emergency department visits. In 2020, we've had 41,585. In 2019, we had 53,961. A significant decline that is there, and then that is directly related to COVID at this point. We're treating sicker patients as measured by case mix index. So the patients that we are seeing that are coming to our emergency rooms, they are being admitted at a higher rate, and people tend to delay their care until they decide they really do have to go to the hospital. So I would encourage everyone, it is a safe place. If you think you need care, please seek us out. Surgical cases, likewise, have declined by about 12% this year. I'm going to change gears, and we'll talk about the extent, type, and value of indigent care for Indian River County residents. The overall value of the care has dropped somewhat based on the volumes dropping this year, but I'll share that with you. The impact of COVID has really impacted this. Cleveland Clinic Indian River Hospital provided $9.5 million of indigent care for the past 12 months, and that's from October to October. This represents a decrease of 14% from 2019. This is reflective, we believe, of the overall decreased utilization of healthcare services because of the pandemic. Breakdowns of the charity care provided include inpatient care. It amounted to $3.7 million, which represents a decrease of 2.8% from 2019. Behavioral health was $750,000, which is a 12% increase from 2019. The emergency room provided $1.4 million in charity care, which is a 34% decrease from 2019, which is related, again, to the overall decreased ER volumes as well as the pandemic. The outpatient hospital has saw a 20% decrease, which represents $2.5 million from 2019 to 2020, and overall professional fees, $1.1 million, a decrease representing a 30% decrease from 2019. And so these decreases in the charity care, I think they reflect the overall volumes that we've seen in the volume decrease for our facility. Year-to-date accomplishments, we activated our Epic Ambulatory Electronic Health System. This, over the long term, will clearly add to our regional, national, and international connectivity, and with the enterprise as a whole. Obviously, there have been challenges along the way, but our caregivers and team have worked incredibly hard on this situation, and we are seeing improvement. A sampling of our responses have included increased staffing and adding 30 new caregivers in the health and wellness space to assist with this transition. Additional training and onboarding, a phone management system, a patient hotline that has been set up, and now a call center which had a soft opening on December 15th, which should help with this situation. We've also engaged our physicians and leadership with an advisory group led by Dr. Mackett and Dr. Peter to engage our physicians as well as the staff on remedies in their local areas. So, Dr. Turner, did you want to make any additional comments? No, sir. Okay. Additional comments or accomplishments, the PCT acquisition is certainly a large one for us. The COVID response, which I'll address separately and go through a number of items. TAVR and MitraClip, new procedures that are offered. Virtual visit adoption went as high as 30 or 40% of all of our visits during the height of the COVID pandemic. Caring for our caregivers, we continue to provide financial support to caregivers who are off with COVID, and they continue on our payroll. We've not had any furloughs at all during this process. In fact, we did raise our minimum wage to $13 an hour during this pandemic, and so I wanted that to be noted. We did increase our ranking in the U.S. News and World Report to number 19 in the state of Florida, with high performance in heart failure, hip replacement, colon cancer surgery, and COPD. We are the only hospital in the region that offers pulmonary valves for patients with COPD and continue to be a referral center for that procedure. Again, successful recruitment of numerous physicians over the past year. Things that you don't see that are important and highlight connectivity. We have had email migration over to the Cleveland Clinic system, so we're now on, I don't have 3 email addresses, I have 1. And so those are important things to note that probably may not seem as large to the public, but they're important in terms of our overall connectivity. We've added new pharmacy carousels and Pyxis administration, the regional call center. And importantly, and I think at the heart of a lot of things today, is we have enhanced cybersecurity, both locally at Cleveland Clinic, Indian River Hospital, and across the region. And we have secured 12,000 devices across the region. So we continue to be diligent with that. With the COVID response, and I'll say a few words, and then I'll have Dr. Rothman come up, who's helping to lead the response, both locally and across the region for Cleveland Clinic. We were one of the first in the county to have drive-through and testing at the start of the pandemic. To date, we've tested over 29,000 residents of this county, and we continue to offer that service. PPE, we've continued to procure and have stockpiles of appropriate PPE, both locally and throughout the region. We have transitioned one entire floor of our hospital, and with the help of clinical engineering, it was made a negative airflow for the COVID patients in short order. And so, again, those transitions take place. Dr. Turner and his team deserve the credit. Weekly calls to our long-term care facilities. Dr. Peter certainly led the charge there, and having weekly calls to alleviate fears, to answer questions, to connect with the community and support our long-term care facilities locally. And again, he had nightly physician huddles, and we still have those once a week, which are through telemedicine or the telephone, if you will, to answer questions. And again, it's a rapidly evolving situation, and there are many questions that individuals have. So I'm going to touch bases on, say, two things about a vaccine, and then I'm going to have Dr. Rothman come up and tell you a little bit about the COVID response in addition, both locally and regionally. The initial supplies of the vaccine will be limited and prioritized based on the guidance from the CDC and the state. Obviously, that'll be healthcare workers, those at high risk. We've been in the planning process for, the prior 6 weeks on the vaccine rollout. We will be vaccinating our healthcare workers and residents of long-term care facilities first. We do not have vaccine on site as of this meeting today. And I'm going to turn it over to Dr. Rothman to make some comments about other preparations.
Hi, everybody. Good evening. Can you hear me okay? Yes. Thank you guys for having us here this evening and for all your support. To highlight a few of Dr. Rosenkranz's comments, number one, it's important for everyone here in the community to understand that we are ready. The Moderna and Pfizer vaccines are on their way. 6 weeks ago, Cleveland Clinic Florida and Cleveland Clinic Indian River anticipated the emergency use authorization coming forward from the FDA. We received that authorization from the FDA on the Pfizer vaccine, and the Pfizer vaccine was rolled out to 5 pre-positioned sites in Florida. Next week, the state of Florida will be releasing 367,000 vaccines, doses of the Moderna vaccine. Those doses will be allocated to 174 pre-positioned sites. Cleveland Clinic Florida, all of our hospitals are listed as a pre-positioned site for the second round of vaccine to be released next week, contingent upon the emergency use authorization from the FDA. We are anticipating receiving the Moderna vaccine at some time next week. It's important to note that the Moderna vaccine and the Pfizer vaccine, while similar in their intervals between the vaccination doses, do require different refrigeration strategies. The Moderna vaccine requires a cold temperature. The Pfizer vaccine requires a very cold temperature. Dr. Turner has been working with the operation teams both here in Florida and in Cleveland to procure ultra-cold freezers for us here in Indian River County, as well as assisting with the rollout across the region. So not only is Cleveland Clinic Indian River ready, Cleveland Clinic Florida is ready. We intend to begin vaccinating our caregivers and those that are considered to be part of that phase 1 group defined by both the state of Florida and the CDC next week. And we intend to continue to partner with Miranda Hawker and her team from the Department of Health as we rapidly look to get vaccines out to anybody who will want them here in the community over the coming months. And with that, are there any questions?
Well, that seems a little vague. I was wondering if you'd be a little more specific.
Sure.
When the general public is reasonably could expect vaccination availability.
It's a great question. The answer is we don't know. We don't know. What we do know is on week by week, we are getting informed from the state on our allocation of vaccine. We know that 367,000 doses will be released. We don't know how many doses our hospital will receive. As we are informed, all of you will be informed, the communities will be informed, the Department of Health has been informed, and we are continuing to work with the teams to be ready to vaccinate as many people as we can, partnering with the Department of Health. Unfortunately, we don't have the exact number of vaccine that we're going to be allocated, so it's difficult to answer that question at this time.
Well, let me ask you this. Do you anticipate in our community, say in the county, that Cleveland Clinic will be a principal source for people to get COVID vaccinations, or do you feel like CVS, Walgreens, MedExpress, other type of?
Great question. We are going to need all resources to get vaccine out to as many individuals as possible. Yeah.
Alan, thank you, Mr. Jones. Thank you for the question. So two things. One, I think as I heard it, when will the vaccine be available to the general public? And I think we're looking at a couple months still. It could be February, March, April. I think as you look at the refrigeration requirements for the ultra cold versus the cold and the -20, that'll be a driver of some of that. Mm-hmm. Hopefully it will be sooner than what I just said. That's a best guess because Rick's answer is absolutely correct. We don't know for sure. But I think we're looking at several months from today for the general public at large, as opposed to the high-risk groups. So that's number one. And the second question was, what role will the hospital play in vaccinating the general public? And I would suggest to you, depending on availability and the mandates from the state, that we'll have a central role, at least early on, much as we did with the testing that took place. And then as the availability and the processes are ironed out, then you'll see the CVS's, Walmart's, and just as you have with testing, you'll see that get promulgated through the communities more evenly. That's my best
Thanks.
guess.
So let me just ask one follow-up.
Sure.
I don't want to prolong this, but I think people are interested, and certainly I am in any event. Should people be calling their physicians, calling Cleveland Clinic, and just or wait for you to contact members of the public?
So I think once we have the availability to give the vaccine to the general public, we will shout loud and far and wide. And I think calling at this point probably strains an already strained system to, we'll certainly receive and try to answer as many calls. But I think that the volume of calls that we get regarding the vaccine right now, when it's not available, can be a hindrance to the system if we're not careful. So I would ask that the community be patient and allow us to make a broader announcement once it's available, but it will be at some point in the future, not immediate.
Dr. Rosenkrantz, I
I do believe probably Cleveland Clinic will be working in conjunction with Miranda Hawker at the County Health Department, because I know we heard quite a bit this morning from Miranda about their plans. And I think all of the not institutions, but all of the healthcare facilities are working together on rolling out the vaccine. I think it's also important for people to know, because Moderna will be released this week, or it's maybe released today and will be here. But if you get the Pfizer vaccine 1 month, you have to stick with the Pfizer vaccine. You can't switch to Moderna for the second one. I think it's important for our people to know that in the community.
It absolutely is the case. Thank you for bringing that up.
Okay.
Anne Marie, is if you get the Pfizer vaccine, your second dose must be the Pfizer vaccine. If you get the Moderna vaccine, your second dose must be the Moderna vaccine.
So I have a question, because I heard this morning on the call that we were on, and I don't know if it was Dr. Peter or Dr. Perone, but that even once we have been inoculated and have the vaccine and all that, that the wise thing is to continue to wear masks and can you talk to that just for a second?
Sure, I can speak to that. And I think for the foreseeable future, vaccine or not, whether or not you've been vaccinated with 1 dose or the full course, that for our communities, for the citizens of our county, to make this pandemic extinguish as soon as possible, everyone really does need to continue to follow the masking, hand washing, social distancing, avoiding large gatherings. That's not going to change anytime soon.
So at what point does that go away? If everybody's vaccinated, at what point can we get rid of the masks and hug each other again?
I'm
What you see
hoping,
is what you get.
so again, that is a difficult question to answer. I am hopeful that it will be sometime before the end of 2021, but it won't be any time before that.
Dr. Rosenkrantz, I think that there's another myth as well, is that those individuals that have had COVID do not need the vaccine, which is incorrect.
That's correct.
Everyone needs to get it.
Everyone should get the vaccine. Okay, so I have.
Well, let me ask, since we're on this topic, I had another couple of questions. Since it's going to be a couple months before the vaccine's readily available, what if one tests positive for COVID in the interim? I mean, everybody knows they should quarantine, maybe take Tylenol, I think you told us last year, to control the fever as needed, but what else should they do? And are there medications available, such as available to the President of the United States? So we know that these things can help, but do you have to be hospitalized to get them, or is there any kind of outpatient action people should take?
So there is the monoclonal antibody that is approved only for outpatient use. You cannot get that on an inpatient basis, and again, you have to be COVID positive. And there are very specific criteria. It is available in this county. We've actually partnered with a facility, I think it is Whole Family, who is providing that service because the bandwidth necessary to both do the vaccinations for the community and that is fairly significant. So that's an example of the partnership.
Okay, so what should people do, though? They test positive. Should they call a hospital? Should they call their doctor? What
They should call their physician.
Just call their physician, okay. And then one kind of incidental question. If somebody's had COVID, so they've got antibodies that probably protect them from symptoms, but can they still pass it on to somebody else even though they've already had it?
So it's unclear how long the antibodies will last. We do believe they're protective. It is entirely possible that someone who's had COVID has antibodies could still be a carrier and pass it on. So the same precautionary measures should be taken with a mask and everything else that we've discussed for 9 months.
I, for one, would like to congratulate all of you on how you have handled this, and we are very grateful that you, Cleveland Clinic, were here for us during this. I'm not sure our county hospital would have survived through this, let alone had the care for the people and the preparations that you guys have had. And I know it's been tough on the caregivers and everybody in the hospital and all that. So we thank you for all that you've done through this very, very difficult COVID situation.
Thank you, and I think, one of the biggest ways to thank our caregivers for everyone is to wear a mask, wash your hands, socially distance, and avoid large gatherings. That's the biggest thing you can do for them today. So I do have a couple other items on the report.
Oh,
We good? Okay, so financials, this is from October through October. The net revenue was $275 million. The overall EBITDA, which is earnings before interest, depreciation, and amortization, was 2.5%. That's about $8.3 million year-to-date, which is below budget, which the budget was $23 million. Overall, the operating income is a negative $6.8 million for the hospital based on lower volumes and based on the COVID response. The COVID response and our costs related to COVID thus far this year have been about $5.1 million. So you couple that with the volume loss because of COVID and you get the financials. Capital expenditures, however, we have spent 11.85 million in capital this year to refurbish and to do a number of items. We had prioritized early on in 2020 $30 million of capital, but because of the COVID and the pandemic, that was cut short in the first quarter. We spent about $6.7 million in the first quarter before we pulled back because of the pandemic and the volume losses and the uncertainty that created. Critical mission requirements has led to over $11.8 million being spent, however, for the total year. The foundation, and we want to thank them for their support, has also funded an additional $2.6 million in capital. An example of some of the machines are the Pyxis machines, which are the drug dispensing machines on the floors for our nursing staff, which is Cleveland Clinic standard. Refurbishment of Cath Lab Room 1, which is ongoing. The Da Vinci Xi robot for robotic surgeries and advanced surgeries, and the equipment that goes with it. The additional items are too numerous to go through, but I did want to just reinforce that despite the financials, we're still investing capital and significantly upgrading what we're doing. Additional items, again, operating room 11, and this is a foundation-funded project, is being refurbished at a cost of $1.3 million as is a step-down unit at a cost of about $500,000. So what are some of the challenges and opportunities? I think as we go forward into 2021, again, it's always a balance of providing world-class patient care. What's the integration with the clinic and the Epic and those challenges that exist in working ourselves through that? The COVID environment and the vaccination and providing those services and leading in the community and providing that reassurance, not only to the citizens, but to the employers, to the school systems, providing support to EMS, both in testing and vaccinations as we move forward, I think will be critical in partnership with the health department and others here in the community. We hope to get back to normalcy sometime this year in terms of our volumes. I think vaccinations, equity, and distribution of that will be important to maintain. Obviously, it is a very valuable commodity at this point, and everyone is important, but we'll have to go through the priority list and go through that. We do plan on a hospital inpatient Epic rollout sometime later this year at a specific date to be determined depending upon the pandemic and what that looks like. In the end, it's been a challenging year for all of us. We want to thank both the hospital district and our community for their support, both in their patronage of us when needed, the parades, the food, the letters, the comments. It means a lot to all of our caregivers. We're here to help support the community, and certainly we have felt the community's support in the last year. And so publicly, I wanted to state that. I'll entertain any questions.
I have a question. Where do we stand on the maternity upgrade?
So the maternity upgrade is on hold. We are in a fundraising process. Obviously, with the philanthropy, we need to be at 50% before we can start construction. And what that looks like, we are at about $3 million. We need to be at about the $6 million mark before we can begin that construction.
All right. That was one question. The other question I had is, when you talk about the decline in volume, I think we talk a lot about fear of going to the hospital in the COVID environment and all that. Is there a piece of it also that because we're social distancing and wearing masks and all that, that people aren't passing along illnesses as well?
Well, certainly a mask, hand washing, and everything we described can prevent you from having respiratory illnesses of any type, whether it's COVID or this is also influenza A season, so it can do that. People, again, I hate to make generalities, but in general tend to be somewhat less active during the pandemic, and so injuries, those types of things that you might normally see, I mean, it's a good thing, right? People aren't getting injured, don't show up to the hospital. So it's a number of factors that exist there.
Yeah. Any other questions?
Yeah, well, first I want to underscore what Mary Beth said about how happy I think all of us are that Cleveland Clinic and your team are here in Vero Beach. It has improved the quality of our lives, and you described progress and patient care outcomes in the midst of volume declines in a pandemic. I think that should be really acknowledged because a lot of people would have struggled. And Mary Beth is definitely right. We didn't have the resources to do it before, so we're really happy you're here. And in the area of opportunity, this is kind of unrelated, but a couple years ago we talked about the possibility of low-income people having access to telehealth capabilities. Is there a way to do that in partnership with Cleveland Clinic in some way? I think particularly Treasure Coast and its operation of the Gifford Health Center, for example. Maybe, because I understand that people might not know enough about operating the computer to be able to do it in a rich way. But if they'd coordinated to, say, the Gifford Health Center and contacted, that might provide a depth of physician care that we haven't had before in a way that maybe is more economical. So I just throw that out there. Is there a possibility of that?
So the short answer is absolutely. And I think if you look at telehealth as a harbinger of the future, as a means to ensure health equity, not to exacerbate health inequity for all populations, I think it is ripe for that. I do know that in Cleveland, our 4C, our population health arm, is utilizing telehealth in underserved communities, just as you described, and offline would be delighted to work with you and whomever to further that endeavor. I'll go one step further to make a comment. You know, we talk about social determinants of health, and we think of the usual things of food and housing and medical care and education. I'm going to add one other item to that because I think it is absolutely key in 2020 and will be in 2021 and for the forever in my lifetime. I do believe high-quality internet access is a social determinant of health moving forward.
Interesting comment. Yeah,
Yeah.
and that's important. I had something else in my head and it just went away. Sorry.
Senior moment.
It's senior, thank you, Karen. Yes, it is a senior moment.
Well, compared to me, it's a junior moment.
Now, I was just going to say that, is there any other questions from anybody? I just think, you know, again, the way that you've handled the COVID, the Epic rollout, which I have been through major changes in infrastructure computer systems before, and they're never, ever, ever easy, and I know it was very difficult. You can't anticipate everything, but having that at the same time as you're dealing with a pandemic, and while you're taking care of patients, and by the way, I continue to hear when somebody's an inpatient that all good things about the care that they have gotten in that. So I think that's great. And when I don't, Mr. Turner usually hears from me, so. Or Dr. Peter. But no, I just think it's been amazing. I think you have built a fantastic team. I think bringing in 53 addition doctors in the last 2 years is phenomenal. I hope you continue to bring them in. I think it's a great place to be. We hope that they all love it here in Vero Beach and want to stay. So I think it's phenomenal. We're very happy to have you here.
Thank you. We're delighted to be here. And again, this is the team behind me is responsible for a lot of this, and our caregivers, their resilience this year, their work, their fortitude in the face of the unknown, in the face of difficult challenges.
How many of your
off to our
caregivers had COVID? You know?
Again, a directionally correct answer is around 80 to 86.
Oh, okay. And where are we in the hospital right now?
As of this morning, that's a great question, we had 16 total. I believe that we had 9 on a regular nursing floor and 6 in ICU. And so we're way off of our peak. We're managing well. But again, we always remain prepared.
Well, I know that the positives, everybody talks about the positives going up and all that, but to my mind, it's always who's in the hospital. And now, so it's good if it's not going up. So, thank you for coming tonight. I know that you guys are busy, but really appreciate all of you being here and the effort. And Dr. Peter, thank you for being on the call this morning. And that helps. I mean, when we learn, the more that people can learn about. So, we really appreciate it.
Thank you, and thank you to the community.
Thank you.
Excellent report.
Thank you.
Thank you, Dr. Rosenkrantz.
We have our funded quarterly reports. I see Andrea is here. So Andrea, we have your report here. If you would have comments, highlights, things you want to go through. Thank you all for coming.
Thank you all for coming.
Appreciate it.
Happy holidays to all of you. Stay
Holidays, Merry
safe.
Christmas.
Wear your mask. Wash your hands. You never
I
know.
don't think so.
So you all have my presentation, so I will breeze through this very quickly. You all are very familiar with us. Obviously, since the last time I stood in front of this group, the world has changed a lot. But one thing that does not change is babies keep coming. So usually I would have a whole slew of people with me, but today I'm alone. So just Andrea Berry here to, and I hope I do a good job representing our mission and vision. So you all know what Healthy Start is. Should I do this for you, Kate? Okay. I can do it. You all generally know what Healthy Start is here for. We're here to establish and support a local system of care that optimizes the health for mom, babies, and their families living in Indian River County. Essentially, that means that we look out for gaps in the system in Indian River County and ensure that we are providing gaps for those, or amending to those gaps. And a lot of that has to do with data. So let's just look at this quickly. I'm going to breeze through this because you guys know a lot of this stuff, but we trend right around 1,250 in births per year. This year, I will mention that we are barely going to hit 1,200, you guys. So I don't know that we'll get there. I'm going to give you guys an update once the year flips over, but that's very rare for us. This is very low for us. So 2020, I'll let you know.
Social distancing.
All the social distancing. I don't know, or maybe the stress, or maybe who knows, but I'll let you know about that. Infant mortality rates, I'm so proud to see this chart. You see that since 2015-16, we've been trending down, and I hope that we will continue on that trajectory, obviously. I always want to mention the racial differences in infant mortality. We still have higher rates of infant mortality amongst Black families and white families. Of course, we are now below state's average, which is fantastic. That is a really big deal for us, and I hope to continue that trend as well. Also, this is fetal death, and this is important just because oftentimes in communities that see lowering of infant death, they see a rise in fetal death. And that's because infant death is defined by first breath to first birth date. But sometimes that is a categorization of the medical professional in the room. So if they do not see a breath or a movement or signs of life, that is a fetal death. And if they do, then it is an infant death. So it sometimes is, you will see the fetal deaths rise, infant deaths lower, but ours is a true decline. We have a decline of fetal death and a decline of infant death, which is just saying that we are all doing a great job. So, let me go back. Okay, so that is because the social determinants of health is the word of the night, I think, or the phrase of the night. It's what Healthy Start does. It's not all about healthcare. It's about behaviors, and it's about the social determinants. And that is what Healthy Starts programs do. They address the social determinants, they address behaviors, and that's why we're truly making a difference. So, COVID response quickly, we took swift action. We went to telehealth. Most of our programs are still telehealth, except for our doula program and all of our hospital-based programs are back in the hospital. And I will touch on that in a minute about the differences in our outcomes when doulas were not bedside and when they were bedside. It's fascinating. So, but what we did, some positives, we really ramped up our online presence. We've done we leveraged funds from the Community Foundation to do a great series it's going to be COVID-proof, which means it's accessible no matter what. So that way, no matter what's going on, we still have that information available to moms, and they can access it anytime they want to, even if it's 2 in the morning and they're up worrying about something, which we do all the time. So now to Nurse Family Partnership. Now typically I would have beautiful Cheryl with me, but she's going to just speak to you. But before Kate presses play, I want to say that I'm not really going to address the outcomes because we did hit all of our markers. You'll notice we're below on 1, which is entry into prenatal care within the first trimester. We're at a 93, we are at 87, we should be at a 90. And that's because those ladies entered the program after that point in their care, so we weren't able to influence that. And our finances are included as well. So you guys can peruse that at your leisure, but we're doing very well. So here's a story from Cheryl, quick story.
Good day, this is Cheryl Martinez, the nurse with Nurse Family Partnership, and I'm excited to let you know about our strengths and some of our successes in the program. The program is for first-time moms, and they are enrolled when they're less than 28 weeks pregnant, and we see these moms all the way up until the babies turn 2. So that's about 3 years we have the ability to provide support to these families. And we see moms from Fellsmere all the way to Oslo. And we are able to provide this support and connect them with community resources to help their families. And I'm also here to tell you about just some of the successes that we've had in the program. And this will be a time frame from October 1st of 2019 to September 30th. Of 2020. We've had 32 referrals that's been received, 13 newly enrolled clients. Conversion rate of referrals to enrollment for Indian River County is 40.6%, and this is compared to Nurse Family Partnership Treasure Coast, 43.6%. Florida would be 38.1%. And a national rate for this would be 37.9%. And during these periods, there have been 28 active clients, and there is an expectation to have the capacity of 25 clients. So we're definitely excelling in that area. And the retention rate for Indian River County during the pregnancy stage is 83%. And the infancy stage of 83% as well. 17 infant births between October 1st of 2019 through September 30th of 2020. And these were 13 full-term births, as well as 76.5%. And also we did have a rate of 23.5% when it came to preterm births. We did have 4 of those. The great thing, we do have 100% breastfeeding initiation rate. And with the ability to be there and to help these moms, we are continuing to improve their health and just be supportive for them in a holistic type of way. And just to share my personal experience in the program, I do have a mom, Ashley, and her 10-month-old baby girl, Ellie. And they have just had some experiences through these COVID times with not feeling comfortable of sending her to childcare, so having to make some adjustments in scheduling and sacrificing working a full-time or not even having the ability to obtain a full-time position, working part-time, and finding it hard to have ends meet at times. So NFP is able to be there and connect her with community resources and to get the things that she needs to help her continue to support her family. And it's so nice to know that I can just with a phone call or an email, and all the resources are just right there, and the community comes together very well to collaborate and provide clothes, financial assistance, supplies, just the ability to go back to school, get your GED, or even further it at a college level, and just really provide the support to the moms so they're able to provide for their families and not feeling like they are just helpless in these situations. So it's not often that you're able to work a job to just be there and support these families and change the future. So I'm so excited about being able to provide this for our families. And I just want to say thanks to the Healthy Start Coalition, as well as all of our community partners. Thank you.
So this is the baby and the mommy and the daddy. They're so cute. And I'm thankful for them letting us use their story. Just a quick note about Nurse Family Partnership in particular. That program is our most expensive and our most for our highest risk moms and families. But the reason why we use this program is it is an evidence-based program that's in its 3rd generation of clinical trials, which means they're studying the grandchildren of the first families that walked into that program and seeing the trajectory of that entire family change from health and wellness, employment, education. It turns the entire family around. Now, we are actually at capacity with this program. I would love to expand this program, but I don't think it's the year for that. But it is a program that is very impactful and will impact generations. So looking forward in the future to expansion. Our nurse home visitation, which is another program that you all fund, we just quick highlights. We saw an increase. We were unable to go into the home, which is, we don't love that, but we do telehealth, and we saw an increase in acceptance. So I think it's something that we will keep around even after things go back to normal-ish. We will still offer the option of doing telehealth, so that might increase our ability to see moms in the home. I'm just saying, and then we still did increase breastfeeding rates over the norm with this program. I do have some quotes and a couple stories, but since we're on time, I will let you guys just read that. It is very impactful. Elaine meets with every single mom, and sometimes you just get on a kind of a schedule of doing things, and then when sometimes when you have a really, really high-risk mom, and then you are able to make such a difference in their lives by leveraging the resources that Healthy Start has available. So, I want to update you guys on the community doula program. So when we were not able to be in the hospital, we were asked to do Megan and I were asked to do a state call with the Florida Perinatal Quality Collaborative. We have such a great and unique program that we are often asked for our data and what we're doing. So we went from having about 30 to 50 clients per quarter to having 9, because the engagement rate, not being able to be in the hospital, they didn't really want that support. But those that did stay in the program, breastfeeding went from 100% when we were in the hospital to 89%, and then the next quarter, 83%. And then when we got back in the hospital, it goes back up. Induction rates with our patients went from 24% when we were in the hospital, 33%, 67% when the doulas weren't there. So the induction rate goes up. And back down to 8% when the doulas were back in the hospital. I'll just highlight cesarean rates. Cesarean rates were at a 3% when doulas are there, 10%, and this is taking out prior cesarean, breaches, and twins. And then we're not there in the hospital quarter 2, 22%. So it just shows the huge impact this program has, saving hundreds of thousands of dollars just by having these trained professionals next to these ladies. And I could give you guys more statistics, but as we get further along and we analyze that more, I'll give you guys more of that. Another huge update is that we finished our report for our fetal and infant mortality report. So it is hot off the presses this week. I will have it. And I would be very, very happy to come back if you guys want to at a chairman's meeting and kind of flesh that out, because it's a lot. But essentially what we really found is that medical causations didn't vary, but it was really so impactful, the social determinants of health. 14 of the 18 women that we looked at were enrolled in Medicaid services. 14 said their pregnancies were mistimed or not, they weren't ready to be pregnant, they want to be pregnant later. So, there's just things that impacted these infant deaths that we could do something about. And so we got together with community members, and many of you in the room, and Dr. Rosenkrantz participated in that exercise, and we will continue that this year as well. But it showed us that what we're doing is working, and we have to keep doing it. So PEPW, Healthy Start has hired our 2 PEPW maternity navigators. They are in the hospital, and they are at Partners Women's Health. There was a little bit of a snag with Megan not getting back to the state in time for a cutoff of some sort, and so we will be getting it. She said that she should hear by the end of the week, but unfortunately she's out. So Healthy Start is in place and ready. So as soon as Cleveland Clinic has approval, we will start doing PEPW. But I will say that the engagement rate for starting prenatal care in the first trimester has improved tremendously, and I think that it has to do with the coordination of services and leveraging those connections with moms. When they do enroll in Medicaid, or if they already are enrolled and we know that they're pregnant, we can contact them and get them into care as soon as possible. So that is pretty much it for me. Do you guys have any questions?
You have a daddy doula.
Yes, we started a daddy doula program. So that is so interesting, isn't it? The gentleman, his wife, he obviously helped his wife give birth 3 times, and he said, I probably could be more useful if I found out what the heck's going on. And so that's what he does. He teaches dads to be that support for their moms. And so we're hoping to get all the dads.
That's awesome.
But isn't it? I love that. Because, and the best father and the best husband feels a little like, I don't really know what to do here. And also in those childbirth education classes that we have, sometimes they're a little intimidated to ask questions or engage because it's more focused on the mother, but these are focused on the father, how you can be the best support to your partner possible. Anything else?
Andrea, maybe,
Yeah.
I don't know if this is worth doing or not, because I have no idea how many people are watching this on television.
Okay.
But the PEPW is something that I think we understand what it is.
Oh,
But for the public, What it really means is that now there's one less step for a potentially Medicaid-eligible mother to get in to get prenatal care,
Correct.
paid for by us, the
Right.
taxpayers. So I just thought, that's a really important element.
Yeah, so what our idea here is that to eliminate barriers to care. So we feel like if a mom calls and she's taking that step to engage in prenatal care, we should help her with that as much as possible, get her in the door as soon as possible. And right now what happens is that we say, are you insured? And she says no. We say, okay, call the health department, figure that whole situation out, and then they'll call us to make an appointment to get you in. But that's a whole next step. Instead of just saying, yep, come on in, and we'll do your labs and we'll fill out your paperwork while you're here, which is, that's what we want to do. Now, I will say that we are doing a good job with the system that we have. We have improved it a lot, but I think that, it's elimination of barriers is what Healthy Start is all about. And if we can make it easier for, those that are maybe less likely to engage in prenatal care, to get prenatal care, we should do that.
That's been about a 4-year journey, hasn't it?
It's my life's journey at this point.
Yes.
We'll get there, we'll get there.
Journey, but I think you guys rose to the occasion, too, of this whole change of COVID and everything else, to be able to continue your services and that. I give you a lot of credit. I think everybody had to kind of change on a dime here and figure it out, but I commend you for figuring it out.
Thank you, we did, and I wanted to say, while Dr. Rosencrantz and his team were here, that they did such a great job, and the MFM, the fetal and maternal medicine doctor, that is a huge thing for our community. He mentioned it twice, I'm going to mention it again. It is amazing that we will be able to leverage that for our higher risk moms. It was one of the things that was identified in the FEMUR and the fetal infant mortality review, and I am so thankful that we have Cleveland Clinic, which is a homage to you all for choosing such a great institution. We probably would not have that right now if that wasn't the case, so thank you.
A lot of good things have come from that.
Yeah.
Yes, thank you.
Thank you.
Thank you.
Have a very Merry Christmas, Happy Holidays, and take
To
care.
each one of you guys.
Enjoy. We have Marie back in the back there. I see you. You can't escape.
In her high heels.
Huh? I'm sure. From Whole Family Health. I like your little avatar bitmoji here.
Race car.
We have my report. Oh, great. Well, good afternoon. My name is Marie Andrus, and I'm happy to give the semi-annual report for Whole Family Health Center, covering the period April 1 to September 30th. Before I get started, though, I just want to express my sincere appreciation to the hospital district trustees and all the staff for the support that we've received from you throughout the past year. So thank you, thank you, thank you. So let's get started. As a reminder, Whole Family Health Center is a federally qualified health center lookalike, and that means we receive no federal grant funding. However, we do adhere to all the compliance requirements of a full FQHC. And we provide a full array of primary health care services for anyone and everyone. Let's get into our data and the funding utilization. So the top portion of the report essentially shows Whole Family Health Center's Indian River County unduplicated medical patients, as well as behavioral health patients. Those are separated into those two categories, which we receive funding for, as well as medical visits and behavioral health visits. And so what I've shown here is the 6-month period, reporting period, as well as the cumulative 12-month period. And you have those numbers, so I'm not going to go through them. I'm actually want to focus on the bottom portion of the table, which really depicts the data related to the district funding. So what I provided in the columns, in the green columns, is our original projections, which we included in our application. The next column, of course, is the 6-month period and the 12-month period in the, we'll call it sort of the blush column. And for instance, our uninsured patients between 0 and 200% of the federal poverty level, which is what the funding is for, we projected 254. Our actual was 227 for the 6-month period and 339 for 12 months. And then we had total billed patients, 107 and 152 respectively. We had billed patients, again, separated between medical services and behavioral health services. And then, of course, a grand total of the visits. Our projection for the entire period was 950 visits. Our actuals were 296 for 6 months and 553 for the total period. So our utilization rate for 6 months was 62% and then 58% for the entire 12-month period. So, of course, this was our first year of funding from the hospital district, and we had a little bit of a learning curve and a ramp-up period, especially in the first quarter. And then in the second quarter, we really kind of hit our full stride, and we qualified many more patients. And then in the third quarter, the pandemic struck, and everything changed, including really moving from face-to-face visits to telehealth visits. And the telehealth platform that we used was really easy for our patients and our providers to get accustomed to, but it did not interface with our electronic health record system. So our previous automated intake system became really a manual intake process. And that process created inconsistencies, and we were really not able to qualify as many patients as we would like to have. So this graph really just kind of depicts what I just explained. We had a little bit of a slow start during that ramp-up period, and then the second quarter we were, full steam ahead, climbing up the hill, and then we tumbled down in the third quarter during the pandemic, and we recovered a bit in the fourth quarter. So our program quality measures, of course, we chose 4 measures, and I know you have the information, so I won't go through them each individually, because honestly, the reality is that we did not meet any of these measures. And again, what I can tell you is that COVID changed everything. In going to telehealth visits, of course, our patients were not in the clinic, so we're not checking blood pressure, we're not checking A1C, and that simply was a game changer for everything. One of the things that we did recognize probably midway through the summer in the pandemic, recognizing this is going to go on for a little while, is many of our high-risk patients, we needed to find a way to get them blood pressure cuffs and glucose monitors and other home health equipment. So we were able to obtain funding and be able to get some of this equipment to those high-risk patients, which really was a game changer for them. These are just some of our services that positively impacted the community. Of course, we're doing the rapid COVID testing, the COVID clinical research trials. Dr. Perrone and his research team are truly amazing. They really are. We're so proud of them. Of course, the telehealth visits, which reached more than 70% of our total visits throughout the pandemic. Still, they're at about 2/3. Chronic care management team, we were so concerned about our immunocompromised patients as well as our chronic disease patients. And we formed a team of care management staff that contacted actually all of our patients every single month to make sure that all of their medication and healthcare needs were being met. We would actually send people out to their homes if we absolutely needed to. We started free local pharmacy deliveries. These, by the way, all happened during the pandemic. These that I'm mentioning right now, we did not have these services previously. The pharmacy deliveries are have really gotten popular. There's no doubt that we're going to continue those services. We actually we got a grant to purchase a vehicle, and we have a full-time driver. And of course, we do the free rapid HIV testing and STI testing, which we have been doing, but we really amped up the volume on that because there's been a higher demand in the community, especially since the health department, I think, paused their testing for a little bit during the focus of COVID. The grant awards and successes, I won't go through every single one of them, but one of the ones that really truly was so impactful to our organization and to our patients has been the emergency COVID funding that you all approved for us. And I can tell you how grateful we are, and the stories that our social services people come back and tell us every single day, especially some of those home health supplies that have been provided, or the phones that they didn't have to be able to do telehealth in, an hour of minutes in order to do the telehealth. The other thing that was just incredible that had never happened before, as I mentioned, as an FQHC lookalike, we do not receive federal grant funding, but for the first time ever, HRSA made funding available. We actually had to apply for that funding, and we did receive it. It honestly is a fraction of what full FQHCs received in supplemental funding, but nonetheless, we're very grateful. And that funding helps pay for expanded capacity testing, meaning COVID testing. So, the staffing resources, we really had to staff up. So we're doing testing every single day of the week. Every week, our numbers increase. And we're even doing Saturday morning testing from both our clinical locations throughout this holiday period because there's been such a high demand. I did want to mention under successes the expansion of our 340B pharmacy access. So during the summer, we actually contracted with CVS, Walgreens, and Publix so that our patients can better access discounted medication. Challenges, well, of course there are many. Patient care challenges, financial challenges. Rather than going through every single one of these, I think that we've done a reasonably good job trying to address every single one of these items. I mean, we've paid close attention to our finances and have aggressively sought out grant funding and have done better than I ever thought that we could have during this period, and actually hired a development manager too that could help us with that process. Addressing community needs, and this is the really exciting part. So I think I told you before that we were going to renovate our entire Vero Beach clinic, and that is a total of about 10,000 square feet. So we started prior to the pandemic in 3 different phases. We finished phase 1. We were going to start phase 2, and the pandemic came. We paused for a couple of months, but we finished that a couple of months ago, and phase 3 will be finished in January, and it looks incredibly amazing. But the really exciting thing is every single one of our departments has expanded the space. So in behavioral health, we go from 2 to 4 rooms, and we have a dedicated Spravato treatment room. Our pediatrics department goes from 2 to 6 exam rooms, and our adult medicine is expanding from 7 to 12 exam rooms. And the other thing is that we've actually hired 5 new providers. 4 will be starting in January, and one will be starting in February. So in 2021, we're going to be rocking and rolling. And of course, our future is looking good. So in our first 3 years of our strategic plan, which will be ending in 2021, I think we got a lot accomplished. So I'm really looking forward to the next 3 years. And I really want to mention these numbers, and they're related to our patient growth. So at the end of 2018, we had 4,302 patients. These numbers aren't up there, but that's okay. Oh, that's really exciting. But anyway, let me mention the numbers. 4,302 patients at the end of 2018. And the end of 2019, we had 6,824 patients, which was a 58% growth. The end of 2020, which we're not there yet, we expect to have about 8,000 patients. So even during the pandemic, our growth is probably going to be 18 to 20% this year. And I think actually the telehealth visits have helped us. So we have really exciting things happening. So this is so phenomenal. The exterior of our Vero Beach Clinic has all new windows and doors. I know you can't tell, but they're really cool. And the next picture is our adult waiting room, which is huge compared to the way it used to be. And the third picture is our pediatrics waiting room, which is so adorable. And I think that is the end of my report. Are there questions?
Marie, can I ask you a question?
Yes.
Did it ever work out that you could you could get some help from the University of Miami nursing, the master's program and those people? Did that ever work out? Were you able to bring some of those people up here, or because of the pandemic, did that sort of?
No, we did the precepting all via telehealth, and we accommodated a lot of students.
Wonderful.
Yes, and they were able to get their hours in.
Good.
Now, during the next period, we had to pause it for a little bit because we did have a couple of providers leave us because though we had one that is in Martin County and has 5 children, and she took a position closer to, closer to her home, and we also had a physician that lives in Brevard County, and
Right.
she also took a position closer to her home. Something that's really interesting to me, I read about a month ago, is that 900,000 women have left the workforce since the pandemic started. And a lot of it is related to childcare, and also, the studying at home. So, the kids are learning from home, except that, someone needs to be there for them. So that has created problems. Plus, women tend to occupy positions in retail, which obviously has been hurt tremendously, as well as hospitality. So it's going to be interesting to see. We did have turnover, too, throughout the summer, and some of the staff had been with us for a long time. It's a little bit sad for us, but of course we look at that as an opportunity to, bring in new people, upgrade from where we are, because honestly, all of this change, it's very difficult to keep up. Our systems, our infrastructure, our operations, our protocols, we definitely have had our challenges, but we are addressing them as they come up. Feel like we're kind of with Dr. Perm with Operation Warp Speed.
Okay. Thank you. It was a very good presentation.
Thank you.
Thank you so much. We
you. I mean,
really
that's-
appreciate your
that
support.
kind of growth is pretty unprecedented, and that's for you to be able to handle that, and along with the pandemic and everything else. I mean, that's pretty impressive. So you guys have done a great job.
Thank you, and happy holidays to everyone.
Happy holidays. You too. You too. All right. Any unfinished business with any new business? Any other business? I do want the annual report. It's a much smaller version this year and all that, but thank you, Kate, for pulling that together and all that. I think it's good to have something to be able to hand to people and say, this is what we do and why we do it. So I think that's good. Did we have any public comment? Kate? Any comments out there? No comments? Okay. Well, everybody, please keep Tracy and her family in your prayers. She's going through a very hard time. Her mother's been diagnosed with stage 4 cancer and is very terminal. Tough at any time of the year, but very tough this time of year. So keep her in your
Very
prayers.
bad this time of year.
Yeah.
So much
very,
of it.
Very, so everybody stay healthy, wear your mask, wash your hands, have as good a holiday as you can have, enjoy it. Keep the spirit. Santa's coming regardless, okay? So enjoy. Thank you, guys.
I am Santa.